those doctors are not, they're not up here. They're at the same level as you. I mean, it's your body. You stand up for yourself. When something's not right, you say it. Don't just take what they say, because if that's what I would have done with the previous thyroid expert, I would not be here.
I always love bringing on patients or clients or just random people that I know have had massive breakthroughs with their thyroid, with their hormones, and where it's really been life changing for them. So today's guest is no different. This is one of our patients, Amanda. Her and I work together directly, and her story is really inspiring, very educating. So, anyone listening to this that is currently dealing with a thyroid problem, we're going to hit a couple topics that, I teach about here and there, but we don't really dive into when it comes to proper thyroid hormone replacement and what it can mean for you if you're on the wrong one. So, we're going to dive into Amanda's story today, and I'm just hoping that it inspires many of you. It gives you hope that things absolutely can change, and just educates you on, and it makes you think a little bit about your own journey and your own current thyroid hormone replacement treatment and whether or not it's working for you. So, Amanda, thank you so much for jumping on. I appreciate your time here.
Yeah, this is going to be fun.
All
Thanks
right,
for
so we
having
have
me.
to start off. We have to start way back, even before we started working together. You were struggling with weight, and that really pushed you to change your diet. So go all the way back to where you began. You were over 200 pounds, is that correct?
Yeah, I was last time I weighed was about probably about 220, right around there. So could have been even higher, but I didn't get on that scale after a certain point.
I get it. I get it. Now, what year was that?
That was 2019, 2018, 19.
Okay. Okay. So not
Hmm.
too long ago. And
Yeah.
what do you attribute, like, what got you there? I mean, go even back further than that. Were you always normally really fit, really thin, and the weight just suddenly came on? Did it creep on through the years? Kind of what got you to that place?
Yeah, I think that I've always been, I kind of have an athletic, muscular build, but I've never been lean enough to really see any of that. And I've always, been a little bit bigger, and it crept on. I think having an, early pregnancy at a young age really stirred up a lot of stuff for me medically, that I didn't know about for a long time. So I think some people always talk about having like seeing pictures of themselves, candid pictures. And that's what happened. My husband took a photo of me sitting on the back of our boat in the river one day. And I'm like, oh my God, this is how my kids are going to remember me. And this is not okay. So I, I really wanted to make some changes there.
And that's very impactful, especially when you do start thinking about your family. And
Yeah.
of course, we think about ourselves, we think about how we feel, how we look, how we look, how we feel, and how we perform. But when we bring in our family and you really start thinking about what examples am I setting for my kids, and I want to be around for my kids. So just
Yeah.
even being obese or carrying excess weight sets us up for all
Hmm.
cause mortality, all disease states that can take us out at an early age. So
Yeah.
that
And being
becomes
in
a really,
pain.
and pain. Yeah.
Yep.
Yeah. When you're carrying around that excess weight, it takes its toll on your body, on your joints, on your muscles, everything.
Yep.
So now, okay, so you saw that picture. Well, before that, I want to go to the pregnancy. So you said it was really after you had your baby that your body started rebelling against you, essentially. And we know that pregnancy is a huge trigger for Hashimoto's. We know that you have Hashimoto's. You didn't discover that until later, but when you're putting the pieces of the puzzle together, can you go back and say, you know what? It was probably the pregnancy that flipped that
Hmm.
switch.
Oh, yeah, absolutely. Because even once I had um that first my first baby, I gained so much during that pregnancy, which obviously you're pregnant, so food kind of goes out the window at that point. Plus I was young, I was 17, and I was able to get my weight back down, but then once I had my second one, um, I was able to lose that baby weight for a little bit, but then as the years went on, I mean, she'll be 14. And I just, yeah, I mean, happy life, didn't care, celebrated with food all the time. That's what America does, right?
Mhm.
And yeah, we just packed it on and I did not feel good. And I've always tried, oh, let's eat this yogurt and these bagels and this, all this diet stuff. And it never worked for me ever.
Yeah. Yeah. And it doesn't for many people. So now we can jump forward. You see that picture of you on the boat.
Hmm.
And then what? What was your next step after you kind of had that fire lit under you?
Hmm. Well, for even before that, for many years, I have seen different doctors trying to figure out why I hurt all the time, like my hips. I had migraines and headaches, and I was diagnosed with all kinds of crap, which might not even be true. It might have been thyroid this whole time. Who knows? But I've had so many doctors say, "Oh, you're too young for this kind of pain. Oh, just lose some weight and come back and see me, and do this, do that." And nobody would really listen to me ever. So yeah, I eventually found one rheumatologist that diagnosed me with psoriatic arthritis and chronic fatigue and chronic migraines and all kinds of crap and psoriasis and all the stuff. And he did put me on LDN at that point.
Hmm.
And I think that made me feel a little bit better. And then I was kind of able to be like, okay, I feel a little better. Now I can move my body. And I think feeling better was the first step for me, and really trying to lose my weight because I did lose my weight with an undiagnosed Hashimoto's diagnosis I didn't have at that time. And I was still able to lose 110 pounds with no hormones and a very low thyroid. So
Right.
I'm surprised that that even worked for me.
Yeah. Well, no, I'm surprised too, but I think, you had youth on your side. And then, like you said, you at least had LDN. So, what she's talking about for
Mhm.
listeners who don't know is low dose naltrexone. And psoriasis, psoriatic arthritis, both autoimmune conditions. Some also say that fibromyalgia is autoimmune. So, we're really kind of, you were a ball of autoimmunity even back then. So, we bring in the LDN, and now we can calm your system down, at least decrease the inflammation. And that took such a load off of your body. Like you said, pain decreased and essentially you calm down your immune system from attacking your joints, your skin, and really essentially your thyroid because
Yeah.
we can easily assume that you had Hashimoto's at that time. Most of the time when Hashimoto's is discovered, it's been around for 10, sometimes 20 years already. So we can go
Hmm.
back and we can say, okay, we know you had Hashimoto's back then. No one was picking up on it. But when you took the LDN, you at least stopped the destruction or calmed down the destruction of your thyroid gland, which obviously helped and helps with weight loss. What diet did you implement back then? Were you keto or carnivore? Did you kind of go back and forth? What was it that actually you did where your body responded and released the weight?
Yeah. In 2019, once my body started feeling a little bit better and I could care at that point, we started with keto. And I woke up one morning and I told the husband, I said, we're doing keto. I don't know exactly what it is, but I've heard so many people have success with it. And that's what we're trying. So just on a whim, we just started Googling, reading, found Instagram, found influencers that were sharing their path with keto and that sort of thing. And yeah, I didn't even work out. I didn't do intentional steps. I didn't really do much of anything. I didn't weigh or track food while I was in the weight loss mode. I didn't really start that till I started weightlifting. I don't know, maybe 6 months or a year after I'd lost the weight. It took me about 16 months to lose the weight, but I think that just showed how many calories I was consuming at that point because I know that I had a thyroid, disease,
Mhm.
but I was into the cake and the sugar and the frosting and the bread, the pasta, all of that stuff. And The husband and I talk all the time that it would be hilarious to actually see how many calories we had consumed before this because we had no idea. So, like I said, I had tried many different ways of eating before, the ones you see in the magazines and stuff like that before keto got really big. But yeah, it worked great for us.
And did you come from a family that ate that way, that ate the cookies and the cakes and that, and so that was just normal, like the standard American diet? You didn't know any different at that time, right?
Right. Yep, exactly. I wouldn't say that my parents binge ate. I certainly did have, a food addiction. I definitely took it to the extreme. So yeah, that's what we grew up with, and then I just took it another step farther.
Well, and kudos to you and the hubs for diving into keto, because that's hard when you do have that sugar addiction and that
Yeah.
food addiction. And really, I
Yeah.
would say it was probably a mix of, a little bit of psychological, like, just who doesn't like sugar? I mean, come on, but also physiological, where when you're in that glucose dysregulated state. So essentially when you're eating the high carbs, the high sugar, and you spike your blood sugar up, you spike your insulin up, ultimately there's going to be an other side of that mountain, and you're going to go into a
Yeah.
valley, and in the low, that's where you get really hangry. So even from a
Hmm.
physiological standpoint, your body was essentially telling you, please go get something, preferably high carb, high sugar, to get us out of this low blood sugar mode. We like it when we're up here, not down here. So
Yeah.
really, you were even battling your body,
Hmm.
screaming at you and pushing you to go eat carbs and sugar. That had to
Yeah.
have been a challenge.
Yeah, yeah. And I always say that I ate any emotion, good, bad, ugly. Every emotion was a chance to go buy a half a sheet cake. And it was a good day, let's buy a cake. It's a bad day, let's go buy a cake. And yeah, it's really rewiring your brain that you just can't do that anymore. And that food doesn't serve you and it makes you feel yucky. And so when we started keto, we did on the weekends. We have a cabin on the river that we frequent most weekends. And we started that. I think it was August. I think it was kind of towards the end of August. And we did have, if you want to call it, cheat meals on the weekends. And so usually that'd be like a frozen pizza or something like that. But we were very good in the beginning, getting right back on. Once we got back home on Sunday and the rest of the week, we got right back on. It gave us something to look forward to at that point. But once I started seeing those results, that really put a fire under my ass for sure because I wanted more and I wanted more and I wanted more. And I felt good.
Yeah. Yeah. It's amazing how just that little movement in your
Yeah.
body can be such a motivating factor to just go all in, feet
Yeah.
first,
Yeah.
the whole thing.
Yeah. Coming from food addiction and binge eating, I know that that is very difficult to do. But once you change your brain, the way your brain is wired, and really think about how you feel and what that outcome is going to be, it really feeds that want to keep going. And that's the name of the game is consistency.
Yeah. Yeah. Absolutely.
So we ended up giving up those, obviously gave up those cheat meals on the weekends and such, and we continued being on the river and doing all the summer things, being as low carb and zero sugar as we could.
Well, and the other thing that occurred that really happened for you is you removed the gluten. Whether
Yeah,
you knew you were doing it or not, it's just a natural byproduct of being keto that
yeah,
you no longer eat gluten. So not only were you bringing in the LDN to help calm down your antibodies, your Hashimoto antibodies, you also removed gluten, which calms down those Hashimoto antibodies. So you were doing things that were good for your thyroid without even knowing it.
right.
And I truly believe that that's why you got those results in the beginning.
Yeah, that could be. Whatever we did, it worked, and I'm glad it did.
Seriously. So okay, so you're losing the weight. You mentioned weight training, and I know that you love it now. Like it's a
Yeah.
passion of yours now. How did that come into the picture? When did you start that? And how have you maintained motivation to continue lifting weights?
Yeah, so I think I started that. I think I reached my goal weight January, February. It took me about 16 months to lose the weight, and I lost over 110 pounds. Like I said, I don't know what the starting weight was. So from what I know on the scale, it was 110 pounds. But I got down and I was just skinny and short and thin, and I wanted more. I wanted muscle, I wanted lines, I wanted definition. And my husband, when I met him, he was big into the gym and such. So he kind of got me into that. Um, and watching YouTube and seeing women with muscle, and I just loved that. I never thought that I would. I've never been into sports, not even in high school. It just was never my thing. But I had to make it my thing. And so the motivation was I didn't want to just be, and I didn't want to be a bag of bones. I don't know what other way to put it. I wanted to have some curves and shape to my body, I
Yeah.
guess is the best way to put it. And yeah, I just really fell in love with it, and it became, like you said, a passion to see how far I could get.
Yeah. Yeah. I think it's so awesome. And anyone that sees you now, my God, I can't even picture you skinny because you have beautiful cap shoulders and biceps and leg muscles. I mean, you look fantastic now. You're just solid muscle. So,
Yeah,
I mean,
thank
you
you.
really worked your butt off. No, you put your butt on. You worked your
I've
Now you
always
got
had
juicy
that.
goods. You got
I've
juicy goods.
always had that.
I mean, just absolutely incredible transformation. All right, so now I
Thank
want to
you.
talk about your thyroid journey. So,
Yeah.
at what point, so before we started working together, you were seeing another thyroid expert. We're going to get into the details of that without giving names, of course. But what prompted you to even start that thyroid journey?
hmm So I remembered that rheumatologist. He did give me the LDN as a last resort. I tried all the other crap with the side effects and nothing really worked. And well, we have this. This is, this is the last resort. This is the only option we have. But I remembered him saying, try this LDN, lose the weight, come back and see me in a year. And so I lost the weight, but I still knew I didn't feel right. I had zero libido. My nails, I had severe pitting and ridges in my nails, my fingernails, my toenails. I just didn't feel good. I knew something was still wrong. And so I'd been trying to chase these diagnoses, if you want to call it that, since 2010. I knew I did not feel good. Um, and my youngest baby was born in 2012. So it's been a long time trying to figure out what was going on. Nobody would listen to me, that whole story. But I heard an influencer on Instagram talking about lab work and thyroid disease and Hashimoto's and all that stuff. And so I go into my patient portal and look up some of my old labs. I never gave two craps what my labs were before. And I noticed the only thing that was being tested was TSH. And if you look at my labs, you could see the TSH is increasing every time I had my labs done. I didn't know that before. Nobody said anything to me, but it was the TSH. And sometimes I had a free T4 test. And that was, around two, maybe a little high. But I heard somebody else talking about it and the symptoms and just speaking about awareness of it. I had never heard of it before. And so I decided that I was going to call up a local functional medicine and get a whole mess of labs done. And I had to request a couple extra things like ferritin and reverse T3 and that. This functional medicine doctor didn't know why I was asking for those extra tests. And so that kind of gave me a red flag. But after researching and hearing another friend of mine on Instagram talk about her diagnosis, and she had no idea she had it, and she didn't have most of the symptoms and such. It was a big eye opener for me to see, zero testosterone and it just the crazy mess of labs. But it took a while, but I knew I needed to at least test and see if that could be the issue, and it was. I was surprised.
Now, wait, remind me, did you have to ask? Were you with that thyroid expert yet, or is this a functional doctor before?
No, I saw two before the
Okay.
one you know about.
Yeah. Yeah. Oh my gosh.
Yeah.
And this is what I talk about so often when I try to warn people about you don't just go to functional medicine
Yep.
because just as your story points out, just because they have functional in the title doesn't mean they know what they're doing with the thyroid. And the fact that you had to actually request a reverse T3 right
Mhm.
there, huge red flag. Now you
And
didn't
I didn't even get it. I didn't even get the
know.
reverse. Yeah. Yeah. So she did TPO antibodies and she did the ferritin. And I think there was something else, but I can't remember what it was. But yeah, the reverse T3 never made it on. So I had no idea what it was before, at diagnosis. But my TPO antibodies were 4,000. So
Oh.
we had Hashimoto's.
Yeah, you think so? Oh my
Yeah.
God. Okay, so you
Yep.
get officially diagnosed at least with
Yep.
Hashi, and then what did that functional practitioner do? Did they put you on anything?
She gave me T4 only. And I
Ugh.
and at the follow-up appointment, I said, I follow somebody who is a thyroid expert and knows a lot about this. And she says that 98% of people need T3 in addition to that T4. And she said, "Oh, I don't agree."
Oh my God, and this person is functional.
Yeah.
Ah.
Yeah. And so at that point, when I was first diagnosed and I was put on, I think it was 25 milligrams, it wasn't very much, but my body, I'm sure we'll talk about later, cannot handle any amount of T4. But I was put on T4 only, I think 25 milligrams. I still didn't feel good. I was exhausted. I just started feeling like total crap once I started that T4, worse than having it untreated at all. Um, and I was in the best shape of my life when I was diagnosed. I just could feel something wasn't right. And at that point, it was reverse dieting. So getting out of the calorie deficit, trying to get my calories up, get that metabolism back up. But once I started treatment on this thyroid, is when things really started to tank. I gained a bunch of weight, and it was bad. So yeah, I fired her pretty quickly.
Yeah, yeah, and
Yeah.
we're gonna put all this together for the listeners, but oh my gosh, this is just such a classic textbook story of again what I try to warn people about. When you go to a functional doctor, functional, integrative, they have that in their title. They don't test reverse T3, they give you T4 only. I'm sorry, they just need to go
Mhm.
back to the conventional medicine system, take
Yeah.
insurance, be like a PCP or something, and shut the hell up and stop taking people's money because that is
Hmm.
just wrong. Okay. So,
Yeah, I think my major mistake, you're gonna laugh again. I think my big mistake was this was also a med spa. So
okay.
I
Yeah, I
got the
mean, that's kind of a
labs,
right.
I
Yeah.
got the labs, and I took the labs elsewhere.
Yeah, I mean, med spas
Yeah.
are great for Botox, but
Right.
beyond
But
that,
that's not what I was there for.
oh girl, like I'm feeling for you all over again because I know people listening are gonna resonate too with your story. So, okay, so you move on from this functional slash conventional doctor and you think, well, okay, now I'm going to seek out someone with thyroid in their marketing and maybe like a thyroid clinic, right?
Hmm. Well, I
Okay.
had taken those labs to another provider that one of my friends through Instagram was seeing for her Hashimoto's as well. That went well for a while, would not give it testosterone injections, which I was also after because I tried the cream that didn't work. He tried me on progesterone cream that did nothing either. But he actually ended up, I, it was like an online, he was out of Texas, and he actually ended up rejecting my medication refills and never told me why or anything, no explanation at all to why he was leaving me with no medication. So then I had to go to, I was at my wit's end, trying to get T3 because I got him to increase my T3, start me on T3 and increase it,
Yep.
but he had a cap. And if a doctor has a cap on your T3, no, run for the
Mhm.
hills. There's
And you were still on T4 at the time too.
Yes,
Yeah.
yes. He had put me on 120 milligrams of NP thyroid. Yeah, my reverse T3 was 35.
Oh my God.
Yeah.
Oh my
I couldn't
God.
get off the couch.
No.
Yeah.
No.
Yeah, I
Okay.
felt terrible. I felt terrible. And so at this point I was really regretting even chasing any diagnosis because it just made me worse.
Wow. Okay. And I'll ask you off air who that one was. I just have it in my mind that I think it's this, oh God, Napoleon complex doctor that likes to bash people on Instagram. I think I know who you're
No,
talking about. No, not that one.
no, no,
I don't
that one
know.
actually blocked me on Instagram. So no,
Oh,
I
okay.
never saw him. I never saw him. Yeah. I have some followers that have seen him that have since left for obvious reasons. And yeah,
Yeah.
no.
That's how he gets his jollies rather than actually
Yep.
helping people. But
Yep. Exactly.
okay, so not that guy. Okay. But
Nope.
anyways, you're epically failed by this other dude. At least you
Mm-hmm.
got a little bit of T3. You're on too much T4. Your reverse T3 is freaking through the roof. It should be less than
Yeah.
12. Okay,
Yeah.
then what?
Mm-hmm. Another interesting fact there too with that previous functional, kind of holistic, but more functional. I actually started reducing my T4 because I was like, I think it's my T4, and I'm listening to your podcast, and I'm listening to you on Instagram and stuff, and learning all of this stuff, and so I start backing down on my T4 from that NP thyroid. And I had another set of labs, and so I think I was at like 60 at that point, and my reverse T3 came down to like, I don't know, 17 or 18, something like that. And I said, see, I knew it was this NP thyroid that wasn't making me feel good. So I backed off of it. And I got that reverse T3 down, and I was taking 60. I think I got up to 60 mcgs of T3 of
Mhm.
liothyronine. And that's when he rejected my refills. But I said, see, I knew it was the T4. I got that reverse down. And he goes, ooh, good for you, like very sarcastically. He was wanting me to go in for like ozone therapy, IV treatment, and stuff like that. I'm in Iowa and he was in Texas. He wanted me to go down there for IV. He said that's the only way to reduce a reverse T3 is through IV therapy and flushing the toxin. And I wasn't doing that.
Right.
Yeah.
Yeah. No, that's just more money. That's more, I mean,
Yeah.
that's
So
thousands. Thousands he would
yeah,
make off of you. Okay.
plus to travel down there. Yeah, plus to travel down there. And so at that point, once he rejected my medication, which I was having compounded at that time, that's when I went to a well-known thyroid expert on many different social media platforms, and it that did not work out well either. She tries, so she does medicine differently, she does labs differently, and so it's the complete opposite of what I was doing before and what I'm doing now. So I tried both ways. So
Yeah.
testing 5 to 6 hours after medication, and 16 to 24 at the latest hours after medication.
Yeah.
And with them testing at peak, which is when your T3 especially is the highest,
Hmm.
that left me severely under medicated. They cut my T3 by more than half. I was on 60 when I started with them. They were telling me, you should be scared, don't do that, blah, blah, blah. They cut me down to 12 and a half T3 a day.
Oh my God. And wait, didn't they
Yeah.
also put you on NDT and increase that again?
Yes, they put me on Armor. So they changed me from NP to Armor Thyroid. Crazy expensive, even with insurance, but we tried it. And I told her that I am very um, reluctant, that's the word I'm looking for, to add T4 again because I knew from seeing the numbers and seeing the proof is in the pudding, taking that T4 down. And at this point, I didn't realize that any T4 was affecting me. Um, so yeah, it didn't work out with them. I told her that I was very reluctant to add this T4. I said, I'll go by your book. I'll try it. I will give it a shot. But I don't have a feeling that this is going to work well, this T4. And so I saw, somebody else, one of her nurse practitioners or something like that. And so at a checkup appointment, we were going over labs and how I felt and stuff like that. And then my reverse is increasing again. And I tried to talk to her about it. And I said, I just want to try T3 only. I want to nix the T4 altogether.
Hmm.
I want to try it. And she was not about that. So she said, well, I'll ask the owner. I'll have her call you because, I don't have a plan for you because you're saying you're not going to take the T4. And she never called me. So after some messages in their portal back and forth, I finally did get a phone call. And I explained to her what was going on. And she said that she has zero patients on T3 only, but her social media says that she does. But she told me that she does not.
Okay. Hmm. And what was your reverse T3 at the time? Did they retest that while you were on their
Hmm.
protocol of this baby dose of T3 and armor?
Yeah, I believe it was up in the mid to higher 20s. So it wasn't quite as bad as the 120 NP thyroid at a reverse T3 at 35, but it was still increasing. And that tells you right there, like you can see your numbers and know what to do with your medication.
Right.
And I was getting to that point to where I was educated and I had listened to you enough times that I knew I need more T3. I need to cut this T4, but they wouldn't let me do that under them anyways.
Yeah.
So yeah, and they wouldn't do the testosterone injections either. They would only do the troches, the gum things, the
Yeah.
little toothpaste things in your gums. That did nothing.
Yeah.
Nothing.
Yeah. That's always a crapshoot. Cream and troches are a total crapshoot with
Yep.
with women and testosterone. So yeah,
Hmm.
I know we changed you over to the injections, and that totally made a huge difference, a huge difference. But the
Yeah,
biggest thing was the T3. So then, yeah, I remember you and I jump on a call even before you sign up. I mean, we talked for like a half an hour.
we did.
I
Yeah.
was fascinated by your story. And I was like, oh my God, girl, I knew right from talking to you that you needed T3 only. I knew it.
Yeah.
Yeah.
Yeah. And you had even told me at that point that, just stop the T4 right now.
Yeah.
And so I was banking off of the only T3 that I had left. So I was trying to, disperse that as slowly as I could to get me to my appointment. So
Yeah. Yeah.
yeah.
Yeah. And then obviously we did what we needed to do with you
Mm-hmm.
and
Yep.
put you on T3 only. And I said from the beginning, I'm like, I think you and I are very, very similar in
Yeah.
our composition, makeup, chemistry, because I'm T3 only as well. And
Mhm.
and I just knew. I knew how your body was responding. I knew what a little bit of T4 would do to you. So what dose of T3 are you on right now?
I take 120 mcgs a day. So I split dose that. So 60 twice a day. And I feel great. Much better.
So essentially with the dude, you were on half of what you needed and
Half.
he wouldn't go up. And
Yep.
then with the thyroid clinic, you were on like a tenth of what you needed,
Yeah. Yeah.
along with the T4 that was making you worse. So, again,
Hmm.
this is the perfect example for anyone listening of when you have a reverse T3 problem. And listen, I also want to add in, of course, we looked for all of the things that push up reverse T3
Yeah.
and we check those boxes, and you had been checking those boxes anyways with your education and knowledge on the thyroid because you had to basically become a thyroid advocate for yourself dealing with all
Right.
of these doctors before. And we did that, we checked all the boxes, but in some people like you and I don't know if you've ever been genetically tested for a SNP, but it doesn't even matter. I mean, we know that you're T3 only, that's just going to confirm it. But in some people, it's not about lowering insulin or increasing magnesium or adding an iodine. It simply is that their body, our bodies, do not convert T4 to T3, period, end of
Yeah.
story.
Yeah.
So, and it just is. And the bottom line of personalized medicine is giving someone what they need
Yeah.
based on their symptoms, based on what they are telling you, based on proper lab testing. And it was pretty much right there in black and white for you.
Yeah. Yeah. It was just some trial and error.
Yeah.
And nobody would be willing to let me trial and error because every body is different.
Yes.
And most doctors don't see that. And that's the problem with today's medicine, in my opinion.
No, it is. It totally is. So
Hmm.
we started you on T4 only. Can you share what your results were over time? Like, what did you start to notice right off the bat with the T and obviously the testosterone both coming in of what you
Hmm.
needed?
I think you said T4, T3 only.
T3 only
Um,
and the
yeah.
testosterone. Yeah.
Yeah. So I started the testosterone injections And I had heard you say on Instagram and your podcast that starting testosterone injections, it may take up to 90 days to take effect. And I did not want to hear that. I didn't want to hear that at all. But that was, gosh dang it, the case. And I hated it. But yeah, around 90 days is when I started feeling that the testosterone because I think my testosterone, I want to say was 14 when I was very first tested with the bundle of labs. And she was supposed to order me testosterone cream and she never did. That was another reason why I left. I waited over a month for her to send me some cream and it never came. But yeah, it did take a little longer for the testosterone, but I'm glad I kept with it because it makes a huge difference. And I try and tell a lot of my friends, women need testosterone too. And don't let a doctor tell you that 5 or 10 is okay because it's not. Um,
Right.
it makes a huge difference. But yeah, so the thyroid stuff, the T3 only, I think I felt better that first week. And then that second week, I started feeling even a little bit better. And then my energy, just it was just a stair step up for the first, couple months, getting that my energy better, my motivation better, the brain fog. Oh my God, the brain fog. That started lifting. T4 was a huge bloat. It bloated my gut
Mm.
huge, a lot, and caused a lot of brain fog. So it was really nice to get that stuff out of my system. I've dealt with that for so long. But yeah, it was pretty quickly that I started feeling the difference in the medications.
Yeah.
Yeah,
Yeah. Okay. And
and
how
the weight
much
loss.
weight? Yeah, I was going to say, how much weight did you lose when you were actually properly treated for thyroid and your hormones?
So when I started with you and we increased, I think we increased to 100 at first, T3, MCGs of T3. And sometimes I take 100, sometimes I take the extra 20. It kind of depends. But yeah, I lost 21 pounds in like less than a month and a half, just getting that weight that I had gained. And I was weighing and tracking all of my food while being on the T4, those previous doctors and all of that. But my weight was just increasing, increasing, increasing. It did not matter what I did. Um, and it's that T4.
Yeah.
So I needed to skip the whole converting and go straight to the T3. And that's what helped me.
Well, and by removing the T4, which
Yeah.
for the listeners, NDT medication, the Armor she was on, the NP thyroid she was on, contains 80% T4 and only 20% T3. So even, pulling that and then bumping up the T3, that's going to plummet the reverse. And when you
Yeah.
take down that reverse T3 and you get someone out of that elevated T3 mode, it's like
Mhm.
you're giving them their body. It's like you're pulling them out of the ICU, essentially. Because when your reverse T3 is that high, your body thinks you're dying in the hospital. And it's
Yeah.
shutting down everything. It's shutting down your fat burning. It's shutting down your brain. It's shutting down your energy. So as soon as you were to lower that and then you give your body that active thyroid hormone that it so very much craves and that every single cell in our body has a receptor site on it for, T3, oh my God, it's like you're newly born again. I mean, a fog lifts off of you and
Mhm.
life is out there again. I don't even know. It's fantastic.
Yeah, yeah, and the doctors that I was telling that I'm gaining weight on this T4 and you keep increasing it and so does my weight. They did not care. They said your labs show that you need T4, you need to take it. I'm like, no, I'm not taking it. So yeah, it was a struggle. And you said you're in ICU. Yeah, I was dying on the couch. I could work out in the mornings and I barely had enough energy to finish my workday. Thank God I work from home. If I didn't, I don't know what I would have done.
Yeah. Yeah.
It was just not a fun time, not a fun time at all.
Talk to me about the effect of your relationships too. Well, specifically your marriage, because I don't think that we focus on this enough. It really does take a toll on the
Yeah,
marriage. I mean, and you kind of had the double whammy. I mean, obviously, with low testosterone, you're going to have low libido, and then we have thyroid issues where you're going to have low libido and mood changes and just feeling bad about yourself and being tired and not wanting to get up off the couch or go out or do anything. How did that start
yeah.
affecting your marriage?
Yeah, yeah, my husband's he's a go-getter. Let's go do all of the things. And I didn't feel good. I was so overweight, and once I did lose the weight, I didn't have the right medications. I knew something was wrong. I never felt good. It did. It takes a toll. I mean, he was very understanding, he knew I was trying to get, the correct medication and the correct doctors and all of that stuff. So he was very supportive. Um, and I'm very thankful for that. But yeah, it does. It puts stress on, your kids and your family and your job and all of this stuff because it's like, I don't know if you've heard of the spoon theory when it comes to autoimmune diseases, but you start a day with only so many spoons, and every task, washing your hair, putting your makeup on, getting dressed, working, taking the kids to daycare, you're giving a spoon. And by a certain time, you have no spoons left. That's it. So yeah, he had to pick up the slack for me quite a bit, and I was thankful to have him there. But yeah, it was stressful, yeah, and zero libido, zero with
Yeah.
a 8 or 7 total testosterone, and I don't know what the free was. She didn't test that at the beginning, so yeah, zero libido for as long as I can remember.
Yeah. No, that's tough. That is so tough.
Yeah,
Well,
yeah.
and now, I mean, now you guys are matched. You might have a little bit more libido than him. And so what are the plans now? I mean, now you have a whole new life in front of you. Are you guys traveling? I mean, what's new for you? Are you going to be doing things that you kind of put on the back burner for so many years because you never felt well?
Yeah, and like I said, it was 2023 when I was going through all those doctors and T4 and all that stuff. And we really, like I talked before, we have a cabin on the river and we were there every weekend. But when I didn't feel good, we were not there. So I
Mhm.
think in 2023 in the summer, we only went like 2 or 3 times. And we are river rats to the bone and we are always there. But that year, no. So we didn't go. And so we're like, we have this cabin we're not using. We might as well sell it. So once I started working with you and feeling better, we took it off the market. I'm like, I don't want to sell it. So we plan on, being on the river and out with friends and in our little river community as much as we can, like we used to be.
That's awesome. That's
Yeah.
awesome.
Yeah.
Well, you are going to have the best summer ever this summer. And I just thank you so much for jumping on and sharing your story. Like I said in the beginning, it was all of that. You gave hope. People can now see and know that things can change no matter where you are in your thyroid journey. You educated through your own experience and you inspired. And I appreciate that because that's what people need to hear. That's what people need to know. They need to know all of that. They need to know what to look for. They need to be aware when they are possibly being mistreated. And they also need to have that hope and inspiration that things can change. So I can't tell you how much I appreciate you coming on, Amanda. I really, this
Yeah.
has been fantastic.
Yeah. And to add to what you just said, they need to stick up for themselves. And that's something I lacked for a long time. Those doctors they're not up here. They're at the same level as you. I mean, it's your body. You stand up for yourself. When something's not right, you say it. Don't just take what they say. Because if that's what I would have done with the previous thyroid expert, I would not be here.
No,
But
no.
yeah, thanks for having me. This was a lot of fun.
Oh, this was amazing, and I can't wait just to see your continued progress. But you're just a rock star right now, and it's only going to get better from here. So thank you so much once again, and everyone. I hope you enjoyed Amanda's story and that it inspires you as well.